Good day and assalamu alaikum wa rahmatullahi ta'ala wa barakatuhu. Greetings of peace. I hope you're all doing today. Welcome to our discussion on Module 2, Introduction on Health Assessment. So for this module, we will be focused on discussing the different purposes of your health assessment, to identify the different components of a health history, to describe the interview process, okay, and then explain the physical examination and its method, and also to appreciate the importance or the rationale why do we need to do the head to toe assessment. Okay, so before we actually perform health assessment, or before we perform any nursing intervention, we first need to know the client's health status. This is why health assessment is considered the foundation of the nursing care. I think we're already familiar with that, diba? We have already discussed the ADPI, or assessment, diagnosis, planning, implementation, and evaluation of your nursing process. So again, the first phase was assessment. Now, we have to get an accurate assessment of our patient in order to diagnose the patient. Now, so what are the different purposes of your health assessment? First is to obtain baseline data. They also supplement, confirm, or refute data. They are confirming information gathered during history taking. Next is to help establish nursing diagnosis and plans of care. Then, evaluate physiologic or patient's progress and outcomes. So, have we achieved our desired outcomes for the plan of care? Then, make sound or clinical judgment. And lastly, to identify areas for promotion, health promotion, and disease prevention. Actually, in a community setting or in community health nursing, we are focused on promoting the health of the patient and preventing the disease, because in the community setting, we're not focused on treating the patient. Okay, so again, why is it considered to be the first step of nursing process? Because without accurate assessment, our nursing interventions may not address the patient's actual needs, because you don't have enough or sufficient information to tell what is the patient's need. Okay, so now let's talk about health history. So the first part actually of assessment is to gather or to obtain patient's history. So again, remember, this is the subjective data. So uncovered data, no? This includes the patient's emotions, feelings, okay? Anything that can be verified only by the patient. So unlike physical examination or the head-to-toe assessment, health history provides information that we cannot directly observe it. It relies on effective communication, okay, and careful documentation using the patient's own words whenever possible. So again, this health history is obtained from clients' information that are not observable to healthcare providers, and only the patient can tell you what he or she feels. So this needs to be documented as accurately as possible using the client's own words when doing a narrative record. Now, the major components of this health history includes, we have here, biographical data, or this includes the name or profile of the patient. We have your present health status or present illness. So what is the problem, or what is the major problem of the patient right now, or the what is the cause of his or her hospitalization for this present time. And then we have here the past health history, then family history, the psychosocial history, and review of body system. So actually, this is the main components. However, there are also different components, okay, that may be included here, such as patterns of life, patterns of life. We have lifestyle choices. So many. So let's just discuss it one by one. Okay. So again, how do we get our health history? Through effective communication, which may rely on interview process. So what is an interview? Okay, an interview is a planned communication between the nurse and the patient. Okay, so again, this is a planned conversation between the nurse and the patient. It allows us to what? First, to give or to get or gather information. It also allows us to identify problems of mutual concern. It allows us to evaluate the change of the patient if there is changes. Then it allows us to provide an effective health education or health teaching, and even offer counseling when necessary. So there are two approaches in interview. Okay, so we can use these two approaches when interviewing our patient actually. First is the directive approach, where the nurse asks highly structured and elicits a specific information. Okay, so example, this is actually focused on mga yes or no question, or there is a definite correct answer for this one. Let's say, what's your name? How old are you? Okay, where are you coming from? So very specific. This answer is very specific. Or example lang natin, do you smoke? Okay, do you drink alcohol? So these are just it gives a very specific answers. Then the second approach is the non-directive approach, which or where clients are allowed or encouraged to control the purpose or to encourage to tell their story freely while the nurses listens actively. So here, in this type of approach, we allow the patient to verbalize more. So example, if you have questions about their recent memory, past memory, so these are just example wherein the patient is capable of or encouraged, or the patient is encouraged to tell their story freely without interruptions. Okay, so it's very, very important that you as a nurse to listen attentively to your patient. Okay. So, during interview process, okay, these are examples of questions. These are examples of questions, okay, that you can use when talking or having a planned conversation with your patient. So, first one is the closed-ended questions, wherein it is a restrictive and generally require only a yes or no question or brief or short factual answers that provide specific information. So this type of close-ended questions can be used on a directive approach. Okay, if you wish to be directive, then you can do that. Actually, the directive approach and using this type of question is very, very common in an ER or emergency room setting. Why? Because we have to get information as much as possible to your patient, and then as fast as possible, because that patient is not the only patient in the ER. Okay, so we are on directive. We, what they call this? We control the subject matter as the nurse. Okay, now for the these are example, no? We have your when, where, who, what, who, do, did, or does, is, are, were, or was. So example, what medication did you take? Are you having pain right now? Show me where it is. How old are you? When did you fall? So these are just example of your closed-ended questions. Now, the second type is your open-ended questions, wherein this type of questions or these general questions encourages the patient or client to provide more information. This also encourages the patient to explain their experiences. Okay, so they invite this type of questions invites the clients to discover, to explore, to elaborate, to clarify, or even illustrate their thoughts or feelings. Example, what or how. So we have here, what brought you today to the hospital, or how have you been feeling lately? How would you describe from the pain you are experiencing right now? So as nurses, we often begin with an open-ended questions and later use a closed questions to clarify informations or important details. So actually, we can use this two types of questions. It's not, we are only limited. So depending on the type of approach you also use, okay, it may also based on that. Okay, so before interviewing a client, so let's talk about what are the things that we have to prepare first before we interview our client. Okay, so before interviewing a client, we need to prepare first the environment. Okay, so this includes providing a private room or partition for privacy. It's very, very important that you ensure one of the ethical principles, privacy or confidentiality. Next, maintain a room temperature. It is needed by your patient to be more comfortable. Okay, and then provide adequate lighting. Okay, to reduce they call this difficulties when identifying the emotions of your patient. Okay, then we have here, reduce external stimuli such as noise, distractions, and interruptions. So reducing distractions as much as possible. You interview your client without any presence. Otherwise, if he or she needs a guardian, okay, but if the patient is adult patient, so I suggest you interview them in a room wherein there is no people, many people around. Okay, and then next we have to provide adequate seating, preferably at eye level. Okay, or sitting at the eye level of your patient so that the eye contact is maintained, and then maintain an appropriate distance from the client, approximately 4 to 5 feet. Okay, so this is what we call your professional distance. It doesn't make the patient feel uncomfortable. And then we have provide a gown for client if a physical examination will be performed. So a comfortable environment helps patients feel safe and willing to share personal information. So now let's talk about the different phases of your interview process. Sorry. So we have here the pre-interaction phase. This is where the nurse review the patient's record, prepare supplies and plans for the interview. So during this phase, there's still no interaction of the nurse from to the patient. So the patient or the nurse haven't met each other. Okay, so here the nurse collects data from medical records, health risk assessment or health screenings. The data is collected from other healthcare professionals during endorsement. Okay, let's say from AM shift to PM shift, you will endorse any doctor's order, ganito, or any updates from the patient. So during endorsement, it's actually part of your interview process where it's a pre-interaction. So review new treatments, new procedures, and prevention strategies from literature. Choose appropriate settings and have all supplies such as documentation, materials. Ensure adequate lighting and temperature, and provide privacy. Then the next phase is your introduction phase. Okay, so from the word introduction, the patient and the nurses have already introduced to each other. Okay, so here we introduce ourselves, explain the purpose of the interview, establish rapport, and assure confidentiality. So you identify the client by using his or her surname or full name if you wish to. Especially if you do have a patient who has the same surname, so I think it would be good if you use their first name. Okay, and then introduce yourself, state the role, and then state the reason for interview and include anticipated time frame that notes and that notes may be taken during the interview. So encourage the client to stop and ask clarification if question is not understood or client need further clarification, and assure the client of confidentiality of data, and the client has the right to choose not to disclose some information. So we don't coerce our patient about what do they need to verbalize or disclose to us. Now, let's proceed to your working phase. Okay. So working phase actually is the longest phase of interview process. So from the word working, this is the time wherein we work with our patient. We implement our plans of care. We discuss things to our patient. This is where we understand the patient's needs, okay, identify health problems, and we collect the detailed information using effective communications, okay. So here we use a combination of open-ended questions and closed questions. We gather data using a variety of effective communication techniques, use effective nonverbal techniques, and be aware of different barriers to effective communication. So what are different barriers that we can encounter? So first, false reassurance. This occurs when healthcare provider assures the clients of a positive outcome. So as much as possible, do not give false hope to your patient, telling that it's gonna be okay, like this one, you will be cured, and ganito. So it's not good. Then we have changing the subject, occurs when there is a discomfort on the nurse's part about the topic, and then there's no discomfort from the patient, then you have to stop changing the subject. And cross-examination, this occurs when the nurse asks multiple questions that cause the client to fear or to feel threatened. So as if you're doing or you're giving a, they call this, or you're having your investigation of a crime. So you have to avoid that one, because you will not get information from your patient if you use that type. Then actual content of the health history is gained during this phase of the interview. So the last phase of your interview process is the closing phase, wherein you summarize important aspects of the interview, and you allow the client or encourage the client to ask questions or express any feelings or any concerns about the things that he or she have mentioned during the interview process. So now let's discuss the different components of your health history. So let's discuss it one by one. So again, the major components that I have mentioned: biographical data, the history of present illness, past health history, family history. We have your they call this review of systems. However, again, those are the major components. However, if we were to include more components, we have your chief complaint, we have your lifestyle, the social history and psychological history, and healthcare pattern. So let's start discussing what is biographical data. This consists of the following items of background information. So we have the name, the address, the age, the date of birth, the location, the gender, the race, ethnic origin, marital status, occupation, the religious preference, healthcare financings, and usual source of medical care. So these are just example of your background information about the client. So the next one is your chief complaint. Okay, now the chief complaint actually answers the questions: what is troubling you, or describe the reason why you came, or the reason why the patient came to the hospital or clinic today. So okay, you ask the patient what seems to be the trouble, or can you give me the reason why you visited your healthcare provider. So that is the chief complaint. Among all the symptoms or signs that he or she experienced, what is the main reason or main symptoms he or she experienced. So next we have here your history of present illness. Okay, so with this history of present illness, this discusses, okay, when did the symptoms started, whether the onset of symptoms was sudden or gradual, how often the problem occurs, where is the exact location of the distress, the character of the complaint, the activity in which the client was involved when the problem occurred, or the phenomena or symptoms associated with the chief complaint, and factors that aggravate or alleviate the problem of the patient. So next we have here your past history or past health history. This may include illnesses, previous illnesses or major infections that you have experienced, okay, such as chickenpox, mumps, rubella, streptococcal infections, rheumatic fever, hepatitis, polio, and so on and so forth. And then we have your immunizations or vaccinations and the date of the last tetanus shot, example, and then any allergies to drugs, to medications, to animals, to insects, to food or other environmental agents. We have also anything that you have experienced accidents or previous injuries wherein you experienced a fracture, you experienced a sprain, okay. And then we have your hospitalization for serious illnesses. So reason for hospitalization, previous, no? If you had a surgery, when was it, and where is it? What's the reason? Okay. And medications, all of the medications you have taken, including your OTC drugs and also your maintenance drugs. Okay, so these are just examples of your past history. Now, for your family history of illness or family history with a genogram, so this includes data to includes data related to health status of the client's blood relative for purpose of trending any genetic or familial diseases, because the patient may experience genetic or familial diseases. So family members should include grandparents, parents, siblings, spouse, and children. So this is asked about the following history data such as heart disease, cancer, diabetes, hypertension, obesity, allergies, arthritis, tuberculosis, bleeding, alcoholism, and any mental health disorders. So construct a family tree or genogram. So this is what we call genogram, a family tree that records relationship, any deaths, any occupations, history of health, illness. So this is an example of your family history with genogram. So first you make your genogram symbols, where is male, female, client being interviewed, the dead, okay, unknown sex or unknown status. Okay, so this line symbolizing husband, okay, if the straight line, husband and wife. And if this is a half of the square or rectangle line is the lines that symbolizes siblings. So combining these symbols provide additional information such as a 55-year-old male with diabetes, okay, diabetes female, 65, and then who is dead right now, and then a 35-old being interviewed, and we have your two unknown individuals. So you have just to use symbols to present the genogram of the data, of the patient, sorry. And then for the lifestyle, this includes any personal habits of the patient, any diet, okay, their sleep patterns, their activities of daily living, the instrumentals, activities of daily living, and any recreations or hobbies of their patient. Now, for your social data, this includes their relationship with their family or friendships, their ethnic affiliation, their educational history, any occupational history, economic status, and home and neighborhood conditions. As for psychological data, this includes any major stressors experienced by the patient and their perception about it, and then usual coping patterns used by the patient for a serious problem or high level of stress, any communication styles, which their ability to verbalize appropriate emotions or nonverbal communication. Okay, so for the patterns of healthcare, this includes, this includes all healthcare resources, that is the client is currently using and has used in the past. This include primary care provider, okay, health insurance as such, or if they have they call this personal doctor, okay, or they do visit community health centers, okay, so like that. Specialists, ophthalmologists or gynecologists, dentists, folk practitioners, okay, for the traditional or complementary type of medication or medicine. We have herbalists or curandero, and then we have health clinics or health centers. So whether the client considers the care being provided adequate or whether the access to healthcare is a problem or not. So that is for your components of health history. Now, let's proceed to your physical examination. So after completing the health history, we proceed with the physical examination. Now again, the purposes are almost the same with your health assessment. Okay, so again, the reason why do we do physical examination is to obtain baseline data about the client's functional ability, to validate information, to identify nursing problems, to monitor progress of the patient, and to promote health or disease prevention to the patient. Okay. Now, let's talk about the head-to-toe framework. Head-to-toe framework. So, the physical examination follows a systematic head-to-toe approach. This begins with general survey and then vital signs taking. Okay, this includes the blood pressure, the heart rate, the heart rate or pulse rate, the respiratory rate, the pain of the patient, the body temperature of the patient, and also the oxygen saturation of the patient if it is needed by the patient. Then you proceed to assessing the head. Okay, you check for the hair, the scalp and face of the patient, their eyes, their ears, their nose, their mouth, and oropharynx, or anything or any organs that is located in the head. After the head, you proceed to the neck of the patient. So you check for the neck muscles, any lymph nodes. The lymph nodes are specifically in the neck area, the trachea, the thyroid gland, the carotid arteries, and neck veins. For the upper extremities, you check for the skin and nails, muscle strength and tone, joint range of motion, brachial and radial pulses, and sensation. For the chest and back, the same: skin, the thorax shape and size, their lungs, their heart, the spinal column, and the breast and axillae. For the abdomen, we have your skin, abdominal sounds, and femoral pulses. Now, we have external genitals, then anus, and then lower extremities. This includes the skin, the toenails, the gait and balance of the patient, the joint range of motion, popliteal, posterior tibial, and dorsalis, pedis, pulses. So using this sequence helps us to ensure that no body system is overlooked. So this is what we call your cephalocaudal approach or your head-to-toe assessment. Okay. Now, so let's talk about the things that we need to prepare first before indulging to head-to-toe assessment. So first, explain the procedure or explain the physical examination. Why do we need to proceed or why do we need to perform head-to-toe assessment? Then instruct the client that all information gathered and documented during the health assessment is kept confidential in accordance with the Health Insurance Portability and Accountability Act. Determine in advance any positions that are contraindicated for a particular examination. Okay, and assist the client as needed to undress and put on a gown to ensure privacy. And the client should empty their bladder before the examination to prevent interruptions during physical assessment and to prevent the patient to feel uncomfortable during the examination. So the patient comfort is just as important as collecting accurate assessment findings. So now, how to prepare the environment. Okay, so the environment needs to be well lighted and the equipment should be organized for efficient use. The room should be warm enough to be comfortable for the client. Ensure privacy, and family and friends should not be present unless the client asked for someone or for minor patients. And then for your positioning, okay, we also consider the client's ability, physical condition, or energy level at age, and organized assessment, so several body areas can be assessed in one position. So there are different examinations that require different patients examination. So example, we have here your supine position. So this is what we call your supine position, or is horizontal recumbent. So areas assessed usually in this position: head, neck, axilla, anterior thorax, the lungs, breast, heart, vital signs, taking, abdomen, extremities, peripheral pulses. We have also your prone position. Okay, so this includes also the areas that can be assessed here: the posterior thorax, hip joint movement. And we have here your Sims position. So areas to be assessed, example, we have here your rectum and vagina. Another position, we have your dorsal recumbent. So this is used to assess areas such as female genitals, the rectum, and female reproductive tract. Now, for your lithotomy position, it is the same. This is also for female, no? So female genitals, the rectum, and female reproductive tract. Now, for the sitting position or high Fowler's position, this includes the assessment of your head, neck, axilla, anterior, posterior, lungs, breast, heart, vital signs, abdomen, and lower and upper extremities and reflexes. So, anything that is not include, example, sitting position, knee, chest position. So, sitting position, any areas such as assessing the gait of the patient, balance. Okay, so this is actually used in a standing position. Okay, so another thing that we need to prepare is draping or drapes. So we have to cover the area that is not what they call this assessed. Okay, so the only exposed area is the one that we will assess. Okay, anything that is not assessed, you have to cover it. And then you have to consider also the degree of privacy and the warmth that you give to your patient, such as we can use paper or cloth or bed linen to drape the patient. Now, for your equipment, some basic equipment tools for your head-to-toe assessment may include your flashlight or pen light. We have your percussion or reflex hammer. We have your tuning fork. We have your tongue blade. We have your tape measure. We have your stethoscope. We have your sphygmomanometer. We have your Snellen chart. We have your gloves, either sterile or clean, depending on the interventions or care that you have to give. Okay, we have your cotton balls. We have your cotton applicators. Okay, we have your ophthalmoscope. We have your otoscope. Okay, so these are just basic assessment tools. So anything, okay, that is used in health assessment in your hospitals, then you can use that one. Depending, it may also depend on the hospital, okay, and depending on the type of head-to-toe assessment you wish to. Okay, so every nurse should know the proper use of this instrument. So now let's talk about the different methods that we used in physical examination. I have already discussed this briefly earlier in our first module. So again, I will just repeat this one. So first method, so do not forget the IPA. That is the mnemonics. IPA or IPAPEA or IPAPEA. Why is it IPAPEA? I for inspection, PA for palpation, P for percussion, and A for auscultation. So let's start first with your inspection. Okay, now for your inspection, you observe the client's appearance. You look for data about mental or emotional status, such as any evidence of distress. What is the tone of voice of the client? Gather about that affect, and then compare sides of the body, symmetry, observe for any color, for the size, the shape, the texture, the contour, the movement, the drainage, to inspect skin lesions, scars, masses, and pulsation. So again, inspection is the method wherein you use your eyes, okay, or sense of sight. Now, next is your palpation, wherein you use the sense of touch, okay? So, It uses fingertips. Okay, we can use fingertips to determine the swelling, to texture, and pulsation of your patient. We use your finger pads, okay, to feel any vibration, especially when assessing chest vibration or tactile vibration in your chest. Okay, grasp with thumb and fingers to feel the size and location of the organs and masses. Use the dorsa or the posterior part of your hands and fingers to assess temperature of the client's skin. And when palpating extremities, palpate bilaterally to compare the two sides. So there are two types of palpation. Again, the light and deep palpation, wherein your light palpation determines skin surfaces characteristics, while your deep palpation detect organs that lie deep within the body cavity. So this is the example of your light palpation, and this is the deep palpation. As you can see here, there's a difference. The fingers or fingernails that is shown here is 4, while as here, it's actually the very visible one is the part here. Okay, so deep. And then we have your percussion. Again, it is this action. It is an act that's wherein we strike our, they call this reflex hammer, or we produce sound. Okay. And then we identify those different sounds and their meaning. So striking body surface to elicit sounds or vibration. So a procedure using a stationary hand or using one hand or using a blunt percussion, which involves non-dominant hand against body surface and striking non-dominant hand with dominant fist to assess pain and tenderness of the organ. So what are the different components of percussion sound? First, we have your amplitude. Amplitude meaning the volume or how loud or how quiet the sound produced. Then we have the pitch, if it's high pitch or low pitch, and the quality that we listen, and the quality of the sound that we have auscultated, and the duration. Okay, how many times or how many seconds, how many minutes have we heard the sound? Now, what are the different characteristics of percussion sound that we can hear upon a percussion? So we have here a resonance. So this type of sound is common when you are percussing the lung fields. Okay, because if it is full of air, okay, so it may result to resonant sound. And then we have your hyper resonance. So this actually come a high pitch sound. If the example, this type of percussion sound is common with patient who has COPD or chronic obstructive pulmonary disease. If there is too much of oxygen or too low of oxygen, so usually hyperresonance. So this is actually a type of percussion sound that is heard, and when it is heard, it is assumed to be abnormal. And then we have your timpani. Okay, this is a musical sound or somewhat around a drum. Okay, just imagine that a drum is percussed, so that is the loud and the musical sound. So this type of percussion sound is very common when you are percussing the abdomen or specifically the stomach of the patient. And then we have your dull. Okay, this is low pitch, which is common when you percuss around the liver and spleen of the patient. And last but not the least, flat. So this type of these characteristics of percussion sound is very common when you percuss the muscles and the bones of your patient. You can actually visit any YouTube videos that identifies different characteristics of percussion sound in order for you to have an idea what is the difference between these 5 characteristics of percussion sound. Okay, it's actually this is very important, especially when you are doing your physical assessment. Kasi if you don't know how to differentiate them, then you will not know if it's normal or abnormal in certain organs. And last but not the least is your auscultation. Now, the auscultation is a process of listening to sound that is produced within the body. Example, the things that we have mentioned, we have your bowel sound, heart sound, lung sounds. Okay, so these are just examples of your sounds that that are produced within the body. So you use the stethoscope, okay, wherein the stethoscope should have bell for listening to low pitch and diaphragm for listening to high pitch sounds. Okay. So now let's proceed to your head to toe assessment. So let's start first on your general survey, okay? The first what do you call this? The first um first oh my god, first area to be assessed, okay, based on the head to toe framework. So this is the last part of this module. The third module will be focusing on the review of systems, okay? So let's start with your general survey. Okay. So the general survey, should be assessed in relationship to culture, educational level, socioeconomic status, and current circumstances. So before conducting a detailed assessment, always conduct a general survey first. What? So you observe, okay, you assess the individual's ability to think, to reason, to cope with feelings, stressors, and behave in socially and culturally acceptable manner. So the components of your general or your quick mental status includes appearance, behavior, cognitive function, thought processes, and perception. Because during general survey, it is actually, or it can be done, the observation can be done during your interview process. That's why you are capable also of identify or assessing the appearance of the patient, their behavior, their cognitive function, and thought process during during the interview process. So again, we check for the age, sex, race, vital signs. This in general survey, we also check the vital signs of the patient to establish baseline data and to detect actual or potential health problems, to check the height and weight of the patient, so ask the client before measuring them to obtain the idea of person's self-image, and use the same scale at a time daily. Okay, so these observations provide important baseline information about the patient's overall health. So after the general survey, then we will proceed to your assessing the head down to the last. Okay, so to summarize today's discussion, health assessment is the foundation of nursing practice. A complete assessment includes obtaining a comprehensive health history, conducting an effective interview, performing a systematic physical examination, and documenting accurate findings. Remember that every nursing intervention begins with a thorough assessment. Better assessment leads to better clinical judgments and better patient outcomes. So that will be all. Thank you for watching this video. If you have any questions, clarifications, do not hesitate to comment down below, okay, with this YouTube video, so that I can read your questions and respond to it. So again, thank you, and wassalamu alaikum warahmatullahi ta'ala wa barakatuhu, and God bless.